Hi guys, this is a video just for anyone that's suffering with some lower back pain. We're going to be suffering it a lot more at the moment just because of the stress that's going on, not just in the world but also when we're homeschooling, when we're working from home. There's been lots of changes going on, so we've got a lot of internal stress as well as physical stress just on the back anyway. Okay, so one of the major things that contributes to low back pain is the diaphragm, and if we don't breathe properly then we will affect our diaphragm because it doesn't go through its full range of movement. So because it's not sort of contracting and relaxing as it should, it actually increases the tension on your lower back, which in turn gives you loads of lower back pain. So for anyone that's stressed, the diaphragm is going to be a problem. So what I want to do is just go through just some nice simple exercises just to work on some breathing mechanics, and then also just some lower back stretches as well. You can do these anytime, you can do them during the day, when you're working, if you want to do them after a workout, anything like that, okay? First thing I want you to do is I just want you to stand up, just as normal, lean forward, try and just touch your toes and just figure out where you're feeling the pain and when, how far you can actually reach, okay? I've just gone onto low battery. And onto like how far you can reach down. So if you're mid-shin, just make a mental note for it, or if you've got someone around with you, just get them to take a picture, just so you can actually see the difference that just the breathing can make to it. Okay, so I'm going to use Rosie as my model. Come on in. So what we're going to do first is we're just going to work on our breathing. So what I want everyone to do is just put the hands just on the ribs, okay? So fingers facing forwards, just so you're actually on the bottom ribs, okay? To use our diaphragm properly, we want our ribs to come out and forward, okay? We don't want to be using our chest at all. If we're using our chest, then we're actually overworking our neck muscles, so that's going to contribute to neck pain, but also it's not going to allow that diaphragm to compress and depress like we want. So what we want to do is put the tongue to the roof of your mouth, just behind your front teeth, your top teeth, okay? And then just relax. There you go. And breathe nice and slowly in through the nose and out through the nose. Okay, try and go as long as possible and so slow. Don't worry about big inhales, it's more about just gentle in and out. So what you should be looking for is the hands. As you can see, Rosie's hand comes out to the side, but it's also coming forwards, okay? So that means that the diaphragm's going through its full range of movement, which is going to be good for us and help relieve any low back pain. So what we're looking for, just do about 5 or 6, just make sure you're comfortable. You can do this when you're at work, if you need just a bit of a relaxation, 5 minutes, anything like that. This will just help just settle down any sort of nervous tension you've got, helps with anxiety, you know, stress, things like that. It's really, really good. Get the oxygen in. Okay? Perfect. All right. Just have a stand up for a minute. So the next exercise, what we're going to do is a sitting slouch. So we're maintaining that breathing mechanics the whole time. Okay? And what we're going to do is, the first thing is going to be, just drop your head down towards your chest. Just relax your shoulders. Reach forwards with your hands. Just bring them together. And then I just want you to slowly reach towards the floor and just allow vertebra by vertebra just to go down to the floor. Perfect. Keep that head nice and tucked in. When you're at the bottom, do 3 to 5 nasal breaths. So in through the nose, out through the nose. So we're aiming to fill all this lower back with air. That's where if you can visualize that, you're going to be on the right track. And then when you're done, reverse it. So come up very, very slowly. Head's the last thing to come up. And then relax the hands. Perfect. Okay. Again, aim for 3 to 5 reps. So we're just going to do the 1, but if you can do 3 to 5, that would be really, really good. All right, have a stand up, Polly. So what we're going to do now is just work out, just going to be a standing slouch. So completely opposite to what a lot of people get taught in terms of keep your back straight, don't bend your back, things like that. We're actually going to encourage Rosie to bend her back. Okay, the key is we're going to start, if you look at the foot, slightly in front, Back foot is just on an angle, so you're almost in a walking position. We're going to bend this front knee just so it's about on top of the toe, okay? All the weight is going through those front laces, okay? So 90% of that weight is going through there, all right? Knee slightly bent, bring the chest forward so your belly button is slightly over the knee, okay? And then what we're going to do, again, we're going to reach forward with those hands, really try and round your shoulders, okay? Drop your head down towards your chest, make a double chin, and then you're going to reach down towards the floor, keeping that knee bent, okay? So you're going to allow the back to bend, and you're going to reach down towards the floor. When you get down to the floor, do again 3 reps of our breathing, okay? So we're trying to breathe here. So you can see Rosie's got a nice bend in her lower back, so that means we've got nice mobility through there, okay? When you've done 3 to 5 breaths, again, push through this foot, so all the intent's going to go through your foot. I don't want you using your lower back to come back up. That's why a lot of people get lower back pain, because they don't use the quads, the hamstrings, the calves well enough when they're actually exercising. So when they're squatting, deadlifting, everything like that, they're actually relying on the lower back, which is why you get pain. Okay, just do another one of those for me. So drop your head down towards your chest, get that knee forward, reach as far as you can. What can happen a lot of the time is the head can end up coming up, but what we want is it to be kept down, okay?